E4112 is an innovative trial that looked at both the combination of MRI and the ability to better identify patients who are candidates for a wide local excision. And those data were presented previously at San Antonio. This data now is looking at those patients that were eligible for the DCIS score, which is a 12-gene score that looks at proliferation and PR, components of the recurrence score, to predict a patient's risk of ipsilateral breast recurrence, either a DCIS recurrence or an invasive breast cancer recurrence. So patients in this trial received, after successful wide local excision, a DCIS score result. If the patients had a low DCIS score, approximately 50% of patients were recommended to not receive radiotherapy. The patients who had intermediate or high risk scores were recommended radiotherapy, and the investigators looked at adherence to those therapies in these two patient populations, low versus intermediate high risk DCIS scores. The investigators then compared the outcomes at 5 years. What was the risk of an ipsilateral breast event, either DCIS or invasive, in patients who didn't receive radiotherapy, who had a low risk DCIS score, compared to those that had an intermediate or high risk score who received radiotherapy? And what the investigators found is that they were very similar. Patients with a low risk score, portending a lower risk biology, who did not get radiotherapy, had a risk of an ipsilateral breast event of less than 6%, of 5.5%. Those that had higher risk scores, who received radiotherapy, had very similar recurrence rates, showing that in 50% of the patients who have a low risk score, potentially they would be candidates to withhold radiotherapy and would have outcomes very similar to patients with higher risk features who receive radiotherapy following wide local excision.